Diabetes, as we all know, is a ever-increasing problem worldwide, and it can have various detrimental effect on the eye. So, sir, what is the effect on the retina?
Retina is the inner layer of the eye from where all the vision goes to the brain through the optic nerve. And because of diabetes, the blood sugar is high, the blood vessels which are going in the retina, they may develop blockage of these vessels. Along with that blockage, leakage from the vessels start. So whenever there is a blockage, as the blood circulation in that area reduces, the nutrition to the retinal photoreceptors goes down, the vision gets impacted in that area. And due to the leakage of the blood vessels, bleeding starts in the retina. Patient starts to notice floaters in the eye, which leads on to scotomas or increase in the blindness. And in later stages, the retina starts to detach from its area. It starts to pull up and leading to sudden vision loss.
Right. And how often do you think diabetic patients should get their eye tested, especially retina?
So as a dictum, as soon as you are diagnosed with diabetes, your first screening of the eyes for diabetic retinopathy should be done there and then.
All right.
And then once a year.
Once a year afterwards. And if somebody's diabetes is not under control with very high HbA1c, so in that case, should it be once a year or should it be more frequent than?
See, if the HbA1c is very high, blood sugar is not controlled, there is more incidence of developing complications in the eye. So he should get the eye checkup more frequently, maybe 6 months. Okay. And if there's some problem diagnosed, then depending on the stage of the problem, may require treatment initially and follow up more frequently.
All right. So what kind of treatment are given to those patients with diabetes and effect of diabetes on retina?
So whenever patient is having a diabetic retinopathy, if it's an initial stage, then just strict blood sugar control, blood pressure control, hemoglobin control, kidney parameters control, along with cholesterol control is advised, and follow-up every 4 to 6 months is advised. But once swelling starts in the retina, bleeding starts in the retina, then we have to do some specific tests like fluorescein angiography and OCT scan of the retina. Depending on that, treatments are advised.
All right. So what treatments do we have at Ayurveda regarding this?
Yeah, so we have the latest technology of the treatments for diabetic retinopathy, which includes doing green lasers for diabetic bleeding in the eye. And if there's a swelling in the eye, then we give injections within the eye, which is a OPD daycare procedure.
All right. Is there a kind of surgery required for any diabetic retinopathy?
If the diabetic retinopathy goes on to further severe stages, wherein detachment of the retina happens, or there is bleeding in the retina, which is not resolving with time or with laser or with injection, then we have to do a surgery which is called vitrectomy surgery, in which the gel inside the eye is removed along with the blood and laser is done there.
All right. And now we see the diabetes happening to younger population as well. So there's a kind of myth that it affects only older people and diabetic retinopathy will happen in older people only and not young people. So have you come across anybody young enough and having those changes which happen?
Yes, so there are two types of diabetes. One is a type 1 diabetes and type 2 diabetes. The type 2 diabetes is one which usually occurs in the elderly, but it's the type 1 diabetes, which is insulin dependent diabetes, which happens in the younger population. And this is more aggressive. The complication rates are much more. And if not controlled properly, it leads to blindness. So these young patients where close follow-up screening for diabetic retinopathy is more essential.